Now, when a couple comes to you after the failed IVF cycle, how do you approach that? How do you approach a couple who has gone through that turmoil?
If stress was the major factor which was causing infertility, maybe a person who is taking stress would not have bared any child. So mostly it is a contributory factor, but not the sole factor responsible for causing infertility.
That's also a very big myth, right? Like IVF is only for women with fertility issues. But we know that male infertility plays a huge role.
But probably now I will tell you, even IVF says that male fertility is at rise and it has also options to curb that.
Can anything be done to improve female fertility in the context of IVF failure?
Yeah, it can be. Something what we call it as pre-treatment. Okay. So in that there are some fertility enhancing surgeries.
Hello and welcome back to Fertility Tales powered by Nova IVF. I'm your host Simrat, and today we are talking about one of the hardest parts of this journey. When IVF doesn't work. Why does it fail? What does that mean for couples? And most importantly, how do you hold on to the hope when your dream feels out of reach? To guide us through this conversation, we have Dr. Indraneel Ashok Jadhav from Nova IVF Fertility, Kolhapur, a reproductive medicine specialist who has helped many couples through the ups and downs of IVF. He began his career in 2010 and has fostered 4,000 plus successful IVF pregnancies till now. With his expertise in treating couples who had almost lost hope after repeated IVF failures and in male infertility, he brings both science and sensitivity to this discussion. Doctor, thank you for being with us here today.
Thanks.
Doctor, when a IVF cycle fails and couples come to you, what is the most common question that they ask you? And has there been a moment that has stayed with you when they come to you after all this disappointment?
Yeah, firstly, they are too much disappointed. Maybe more amount of complex questions they have. Primarily, they will ask, first of all, that why they got this disappointment by knowing what went wrong before. Maybe a little hopeful patient may say, like, what we can try next. Or a more calculative patient may say that what might be the success rate in the next IVF cycle. So here we have to understand something, that the previous clinician or previous IVF consultant, if he or she has not given proper realistic expectations that this cycle will turn into, then this becomes a mess. So probably, if I can say, if a woman is less than 35 years, around success rate is 40%. If she is between 36 to 38, it's around 30%. If it is 38 to 40, maybe in 20s, and more than 40, it is less than 10%. But in Indian scenario, if we see, it is a 7 to 10% less due to low technologies available for doing IVF. But still, the problem doesn't end here. Maybe I can counsel her that you should go for IVF cycle as success rates are more. But what means that IVF is successful? To have a baby in the hand, which is called as live birth rate. So if we see technically on scientific basis, if a female undergoes 3 IVF cycles, then the cumulative live birth rate or take home baby rate is 45%. Maybe for 6 IVF cycles, it's 65 to 75%. And lastly, if more than 6 IVF or more than 40 age, I think it is not recommended for her to go further. So this is the complete picture which should be told before going for any IVF.
Okay.
Mostly one story has stayed with me since long, that probably one patient who had like IVFs at elite centers in Pune and Mumbai, around 5 IVFs she had. She had lost hope. She had adopted a child. She was rearing that child. But due to relatives forcing her to meet me or friends who had got IVF successful from me, she approached me with first a forceful start. So the problem was to convince her to take treatment was the major part.
Right.
And again, now you know that if she has undergone so much IVF, her age might also be on the higher side.
Right.
So probably also her previous IVFs were done by donor eggs, and this time probably the call was to take donor eggs. But somehow she came in a moment when there was a new ART law which was coming, and that stated that donor eggs should be routed through a particular government channel. So I was helpless in giving her a donor option.
Right.
So what next? Now she is ready to take IVF treatment. Cannot go for any donor eggs, but now I have to treat her. So with the proper case evaluation, I started her IVF with less follicles, less eggs. And to my surprise, I got a single embryo which was of good quality. Now the problem with her in previous IVF cycles, why she was not conceived, was her uterine lining, or in other scientific words, we can say that it's endometrium. It was very thin. So next step we went for transferring embryos, and 4 or 5 times I started preparing a uterine lining. Somehow it was unsatisfactory. But this was my last chance, this was her last hope, and this was to be successful at any cost. So we resorted to what was called as modified natural cycle, in which with her own eggs to make ready her endometrium is the crux, and that we tried and transferred embryo, and she is now with a successful own gametes, own biological child with multiple IVF failures with the adopted child, and that is a success story which I want to share with you.
That's a great, interesting story, how you were able to, how I think her biology also supported the luck that she came to you with, and also your expertise helped her get her offspring. But Doctor, you described about setting realistic expectations from the beginning, and also success rates of how doctors should have that expectation with their patients and have that conversation. Could you tell us a little bit about that? Like, so many patients come to you after having done so many IVF cycles. What is your approach towards that?
See, if I can just tell you one simple example, like you are having headache, would you go for an MRI? Probably not.
Case, yeah.
So there is something what we call it as stepwise escalation of treatment and stepwise escalation of investigation. So probably how we will manage headache. At home, we will prepare a nice good coffee, have coffee, and if your headache is over, then you are fine.
Right.
Suppose you are not getting right with that, then what you will do, you will approach a local practitioner for taking a tablet. Suppose you take a crocin, still it is not actually going good, then you will approach a medicine doctor, and lastly to a neurologist. And then till then you will go for a MRI, CT scan, and do some invasive surgeries. So in the same way, when a couple comes for IVF, like what is doctors thinking? In Indian scenario with low resource setting, we should give higher success rates because all patients are not insured. They are paying from the pocket. Right. So this should be taken care of. So in this aspect, actually, we should previously done IVF cycles should be studied at depth. First is how the embryo was prepared. Maybe second, what is the uterus. Maybe third, what is the lining, and what are the steps taken for proper implantation.
Right.
Supposedly that we go through this evaluation process, still I may give you hopes, but some things are variable, some things are unpredictable, some things are uncontrolled. As we can say that you see flashing news of floods. So do you expect that on this and this date of next year there will be flood and this area? No.
You can't preempt.
So
right.
it is always variable. So sometimes there may be flood, sometimes there may be tsunami, sometimes there can be earthquake. So what is different then? So each time, each female's hormonal fluctuations are there, eggs are different, sperms are different, conditions are different. And also to add up to it, when we have egg and sperm in our hand, actually there is permutation and combinations that is happening, which science is also taking care of. So if you see that follicles are there, out of that, those follicles 70% are having eggs. Out of eggs, 70% are mature, and out of those mature, 30 to 50% are embryos. Then if I ask you that why that 10th follicle was not having egg, so that is the variation which science is also taking into consideration.
Right.
So in that way, so for going for next IVF cycle needs proper evaluation of what was done before. Secondly, what can be added as advanced modality of treatments at each phase.
Right.
Thirdly, we can say what are the advancements which were not done before. And fourth is most probably and most essential for any patient with failed IVF cycle to know what may be the process in depth, what may incur in terms of commitment to the cycle, maybe how many injections at what time, what is the importance of time,
Right.
and in that way we should proceed further.
Right. I hear so many permutations and combinations, like you said. There are so many factors that are important and that might lead to a success or a failed IVF cycle. But do you think, is there anything a couple can do by themselves? Like, for example, can they make interventions in their diet or exercise, or are there any factors that they have control over to make this into a successful IVF?
Yeah,
cycle?
probably you are on the right point. Now you are seeing that with the couples having career oriented approach or late marriages or stressful lifestyle, as we can say, the diet which we expect from a couple, or which is like, these apps are coming, just switch on the mobile and within 10 minutes
Easy
food is
deliveries and
delivered.
other things, yeah.
So these foods are actually lacking what we call it as antioxidants, which are present in fresh fruits and fresh vegetables. So these lack of antioxidants with the combined factors of stress, delayed parenthood, or maybe the lifestyle like excessive smoking or binge drinking with sleep deprivation, these all lead to most probably infertility. So what we can take care is that we can have a healthy diet. Maybe if you're not well versed what qualifies for a healthy diet, you can approach any nutritionist. Secondly, lifestyle modification, in which must is at least a 20 minutes aerobics exercise, which may actually boost endorphins, boost positivity, boost positive mindset. And lastly, coming to what makes the most important for causing infertility is sleep. So there is something called as circadian rhythm. As you wake up in the morning, you have your breakfast, you have lunch, you have dinner. So probably the next day you don't have lunch, you feel hungry. Am I right?
Right.
So that is how your body is accustomed to. But now, the next month what you do breakfast at 12 o'clock in the afternoon and you don't do dinner, and next day in the morning 6 o'clock you will have your breakfast. So now your body doesn't know that when it should be hungry, when it should eat, and when the nutrition should go into the body. So the body is disturbed, you are disturbed, hormones are disturbed, and everyone is disturbed. So if at all sleep is there for 8 hours, this manages this rhythm. So body knows when which hormone should be produced in what quantity and when it should be released in the body. So this circadian rhythm is of prime importance. And also you should be relieved out of stress while doing these things, because something what I feel I've seen over years, which is paradigm change from the couples I was treating some 12-15 years back and now, is that firstly there were some biological problems which were causing infertility. And now the paradigm change is that interpersonal conflicts, or they are not having proper relations, and this marital discordancy is making the problem worse.
That's true. And you mentioned stress right now.
Yeah.
And what I'm hearing is there were biological factors before, and now there may be so many physiological factors, including interpersonal relationships. Now, when a couple comes to you after the failed IVF cycle, they are anyway under so much stress from having a failed IVF cycle. How do you approach that? How do you approach a couple who has gone through that turmoil? And what would be your advice to somebody listening who has gone through a failed IVF cycle?
Yeah, regarding stress, I want to tell you like two things. Firstly, if stress was the major factor which was causing infertility, maybe a person who is taking stress would not have bared any child. So mostly it is a contributory factor, but not the sole factor responsible for causing infertility.
Right.
Secondly, I think as a clinician also we should mature enough. Like suppose if the patient was bound to change his or her lifestyle, was bound to take a proper diet, firstly she will not be suffering from infertility. Secondly, if she is suffering and I am saying that she is my patient, doesn't mean that I should tell her why you are eating this, why you are eating that, why are you so obese. So you should accept the patient as it is the first step, because these processes of lifestyle changes may be in the primary years of infertility. But those are not relevant according to me when she has prolonged infertility more than 5 years. So when I say my patient, I should accept the patient with the weight, with the lifestyle she is having, with the diet which she is having, and then I should now rethink that what I can do best for in these conditions.
Right.
So secondly, what incurs more stress? Suppose that you have called me for a dinner at night 8 p.m. and maybe I am not hungry. Maybe I will just have 1 cup of coffee and some burger. But still, it is not the question of that cup of coffee or burger, it's what goes for that commitment. That I have to go 8 o'clock, then I have to start at 7 o'clock, I have to get ready at 6 o'clock, and then I have to have that kind of flexible timing with the traffic to reach that place and then have a coffee.
Right.
So that is the problem what actually a couple faces during this IVF journey. So mostly they are stressed more about what is coming next, what is going regarding me, and what I have to take regarding this medication. So here comes the role of a dedicated IVF team. So first of all, a female or a male undergoing this treatment is under tremendous mental stress.
Right.
So you need some psychological counselor to accompany, to pacify them at each step. And this is of very high importance, as government has also taken cognizance regarding that.
Right.
As you can see, this new ART Act which has come up in 2022 mandates, I'm saying mandates for a psychological counselor to be in ART team.
Right.
So that is the importance of a psychological counselor.
Yeah.
But in Nova also we have a clinical coordinator who can tell you regarding what medications are to be taken, at what time, and how those should be addressed. Again, we have some customer care executives which actually will help you in actually pointing towards the appointment. And lastly, your IVF consultant is only doing IVF and is available for counseling to give what I was stressing on, realistic expectations from this IVF cycle and what it should be. So maybe this is the way in which we can curb at all if lifestyle changes are helping for infertility. If we are not averting the changes which are expected from the patient and accepting to go forward, at least during treatment we can pacify that stress and then move forward, and the life journey can become successful.
That's true. I think preparation is very important, and dedication to something that is life changing is the key. And following your clinician's advice is it is of utmost importance. But I want to talk about something very real. When an IVF cycle fails, women tend to blame themselves. They internalize the whole problem and they sort of, blame themselves. But in this situation, how do you think, I'm going to ask this as it is there anyone's fault? There are so many factors that are associated. So what do you tell your patients about this when they internalize it and you see family blaming the women? Or do you see that?
See, here like 2-3 points are taken into consideration. Like first of all, suppose me and my friends go for a long trip to Goa of 100 days. The last day we are returning and sitting in a car, none of my friend will ask that how many kids you have and what they are doing. But the problem regarding females is that after 10 years also her best friend meets her the second question she will put, yaar bachcho ka kya hua? Like what about babies? And so somewhere around, wherever she is working, at home, at relatives, or anywhere, there is some point of subconscious stimulating that you don't have a baby. Second thing, if I just simplify this, like what is this whole process of infertility? A sperm, a egg, and a uterus. So 2/3 of the portion is bared mostly by a female. Secondly, now the treatment aspect wise, what is the role of male in a treatment is just giving a sperm for fertilization. But who is taking this brunt of medicines, this brunt of commitment? So everything is done by the females.
Right.
So it's obvious for a female that she will suffer more with a failed IVF cycle. But now going to science or going to what society says, it's actually wrong on part of societal understanding that females are only responsible for causing infertility. If I just grade it, so 40% males are solely responsible, 40% females are, and 20% may be mixed or unexplained. But here, again, I want to stress on one more thing, that male fertility distribution pattern is increasing nowadays. And it is going above female, which is rising from 40 to 50%. So you are now seeing that the changing trend in the last 10 years is stating that male fertility is actually declining, and the distribution of cause of infertility is more now going towards a male.
And that's also a very big myth, right? Like IVF is only for women with fertility issues. But we know that male infertility plays a huge role, like you just mentioned, like in the last 10 years that you're seeing this pattern. Could you share how often does this come up, and why is this still a taboo when there are so many issues coming up with male infertility?
Most probably, first maybe this societal pressure, which is a patriarchal society, like it states that the male is supreme.
Yes.
Maybe second is some misconceptions about masculinity, like there is one like famous dialogue ki mard ko dard nahi hota, so they come in that aura probably. Or this culture and traditions in which our ancestors thought that it was female's problem, and there was openness for a second marriage if she is not conceiving, but not knowing like where is the cause and who is actually the causative factor for causing this infertility.
That's true.
And lastly, it becomes very difficult for a man to accept that maybe something is wrong with me. But probably now I will tell you, even IVF says that male fertility is at rise, and it has also options to curb that. So what actually we do in an IVF lab is that we harness these sperm's different qualities to get a good quality sperm to put it in an egg to prepare the bestest quality embryo as it is possible.
Right.
So primarily जैसे हमने सुना है कि टेढ़े चलने वाला जो आदमी है वो बहुत बड़ा होता है जिंदगी में, maybe that is true at microscopic level. As sperms जो cross motility sperms के रहते हैं, those are in capacity to form good quality embryos. So there is some technique called as microfluidics, in which actually cross motility sperms are collected and those are put inside an egg to get a good quality embryo.
That's very interesting.
Maybe ऐसे कि एक जो दिखने पे हम बोलते हैं, तो ऐसे कि morphological selection, तो जिसमें हम what we do कि we will zoom that sperm 6,000 times through Nomarski optics and see if that head is a bulgy one of sperm or neck is big or two tails it is having, which qualifies for IMSI technique.
Okay.
Again, by seeing at sperm, nobody will know that how much maturity is having. So in PIXI, we will put it in some fluid in which it will stick to a mature sperm and that will be selected. Or with patients with high DNA fragmentation, low DNA fragmentation sperms can be selected by putting some magnetic material. The sperms sticking to magnetic material are high DNA fragmentation and low which are not sticking. So even IVF is saying that male has an issue and that should be corrected scientifically in a microscopic way So now there is need for awareness that yes, male can be responsible. Yes, there are options available for male fertility available.
And that should be the changing trend, right? Like it's a shared
Yeah,
burden for a
surely,
couple.
surely.
That sounds interesting. You've broken down the male infertility for us in a very simple way, and it is changing for sure. The paradigm shift from the blame to female is also now a shared burden with male, right? But on the other side, can anything be done to improve female fertility in the context of IVF failure?
Yeah, it can be something what we call it as pre-treatment.
Okay.
So in that there are some fertility enhancing surgeries. With laparoscopy we can operate a endometrioma, fibroid,
Right.
and yeah, most important thing, some patients we see that some fluid is collected in her fallopian tubes. So many clinicians in the historical we were leaving that, but somehow that fluids become toxic to the embryo which we are transferring or may cause uterine contraction. So now we actually remove that fluid filled tube from her female's body to increase IVF success rates.
Right.
And now the newer guidelines are stating that third eye of a IVF consultant is hysteroscopy. So in hysteroscopy, if septum is there, remove it, polyp is there, you can remove it, or else some submucosal fibroid, you can remove it. And what comes to the most consideration is something called as endometrial scratching.
Okay.
As I can see here, if I scratch here, it might be a little reddish. So what is actually happening? After scratching, there is increase in blood flow,
Right.
increase in blood flow quality, the quality of endometrium. So these things are taken into consideration. So now in some centers, endometrial scratching has become a norm.
Right.
So maybe this is surgical parts. There are some drugs also which can help in actually enhancing. Like many females complain, यार मेरा age ज़्यादा हो गया है, मेरे अंडे कम हो गए, quality कम हो गए, is what was explained to them by a consultant.
Right.
So there are some drugs like DHA, testosterone to increase the quantity of eggs.
Okay.
Some like omega-3 fatty acids or CoQ or antioxidants to increase quality.
Right.
Secondly, the main issue what a female faces is that sometimes the bed where the baby is going to sit, which we call endometrium, is not that good enough. So there are many ways, some like stem cell therapy, PRP, in which we can improvise that. And one more important thing, suppose that these 5 vessels which are supplying blood flow to the baby, and 3 of them get clogged. So there is less blood flow, less nutrition to the baby, and then the baby doesn't grow.
Right.
So something called as blood thinners like aspirin or enoxaparin may help. And lastly, a newer concept has developed. Suppose that I cross India-Pakistan border and go to Pakistan. Do you think that they will keep quiet? No, they will just attack on me.
Yeah.
So there is this phenomena called as immunorejection. When a mother's body says that this is not my part of the body and it tries to destroy that baby. So this is immunorejection. So what logically we can do? Suppose if I apply for Pakistan visa through Indian embassy and I have an official visit to Pakistan, do you think they will attack me?
No.
Probably not.
Right.
So such kind of drugs we are having, like some steroids, some immunomodulators we call it, like intralipids or some kind of immunotherapy. So what is actually these doing? These are actually little bit lowering the immune system of a female's body, but not lowering that extent that she will get multiple infection. So this is what we call it as immunomodulator dose. And with the dose also we can help that woman conceive further.
Okay, so there are a wide range of investigations that can be done to prep for female fertility. Many couples that might come to you fear that after repeated IVF failures might harm future fertility. Is that true?
Maybe wrong. Actually, repeated IVF failure does call for higher modality of investigation. So we should go into the depth why she is having repeated IVF failure. So maybe the genetic component has to be evaluated, or rather the timing of baby transferring in mother's womb should be evaluated. So these are two things which should be evaluated in repeated IVF failures. So what is this genetic thing? Like many patients come to me and say that this doctor, we have undergone already genetic testing, and those are normal, and those are done thrice or 4 times. And now what is wrong? But the problem is understanding of what genetic testing qualifies for a proper genetic testing.
Right.
So mostly this test I am talking about is karyotyping. So suppose you go home and check in cupboard that there are 26 books, and you just count those books and come back and tell me, no, I have seen there are 26 books, is what qualifies for karyotyping. But if you know that previously this 13th number book, 40th number page was wrong, and now you go and see that 13 number book is Sanger sequencing, but now you sit down on a table, stay for a day, read all the 26 books word by word, paragraph by paragraph, see that if it contains meaning or not, if the phrasing is wrong, and then come to with a comprehensive report, qualifies for what we call it as whole exome sequencing testing. So until and unless any couple who has done this whole exome sequencing report, which is normal, then only we can say that genetic tests are normal. As we discussed earlier, that when sperm and egg meet, there are permutation combinations, and those result in different quality embryos, different depth embryos, different embryos which are durable, different which are arrested.
Right.
In the same way, again now the genetic components of a mother and father, when combined with the embryo, there are again genetic testing which are saying that those embryos are genetically normal or not. While growing of that baby, if there are some cells which we test is cell-free DNA, that is genetic testing. Second, maybe like we can take 2 cells from that baby and then check, that is PGT, which is available. And those testing may help that if genetics was the cause that had caused this repeated IVF failure. Now second part is implantation. Implantation सुनने में थोड़ा complicated लगता है, तो उसको मैं थोड़ा सा simplify करता हूँ. Like I can give you one example. If at all in one tuition there are 10 students, and out of that 7 students are understanding a given page in 10 minutes.
Right.
And rest 2 students are understanding in 20 minutes, and the last student doesn't understand at all, how much time you give it to him?
Right.
So maybe as a teacher, if I take test at 15 minutes, 7 will pass. At 25 minutes, 9 will pass. Then if I take test any time, only 9 will pass.
Right.
So what has happened here actually is that those 2 students who passed in 25 minutes test are also actually intelligent, but somehow their understanding timing is different.
Right.
So in the same way, the baby or the embryo which is actually put into mother's womb also has some phenomena called as window of implantation.
Right.
So every female has her specific days in which she will be receptive for a baby to stick to her womb.
Right.
So mostly by knowing this answer, 80% doctors do presume that maybe this is the right time when the baby should be put in her womb. But now we are talking about what? Repeated IVF failures. So here we can take a call. Is she in that 20% who is having some different time in where this embryo should be put in her womb?
Right.
And that can be done with some test called as ERA test, in which we take some material from the mother's womb, send it for testing, and know like what is actually the time when this baby should be transferred to mother's womb so that she lands up in pregnancy.
Okay.
There are other causes of repeated IVF failure. Maybe this is outside the purview of what we are talking. Maybe we can individualize it on case-to-case basis.
And I'm sure every case will be different, and you
Yeah.
treat it differently because the investigations that go into it are highly personalized at Nova. I did come across something called as Nova Self Cycle. Could you tell me a little bit about that?
Yeah, that is like one point where I want to speak much more about. Maybe if we Google on internet, there are like variable success rate which are shown. Sometimes it may be falsely exaggerated. So why I am saying this is that when we calculate regarding standard success rates, it's with their own egg, own sperm and own biological child. So in metros, if you see, there are 30 to 40% of donor cycle proportion.
Right.
In tier 2, tier 3 cities, maybe 20 to 25%. But what is it landing up to? A falsely elevated 50 to 70% success rate, which is not actually of their own biological child.
Their own gametes. Yeah.
Their own gametes.
Right.
So these are falsely elevated success rates. Then like why then Nova is saying that self-cycle or self-cycle first campaign is that we have firstly, as I told you, dedicated team of expert people who are dealing with the case, and most probably the IVF specialist. So if you see that all over India, pan India, the IVF specialists working at Nova are with the highest level of expertise in which pre-treatment plan can be properly and sensibly designed in a way that the patient gets optimum outputs. Then the stimulation may vary case to case basis, as I told you that individualization of case is important.
Right.
Then thirdly, our embryologist, oh God, they are just brilliant. If you give them 2 or 3 eggs also, they are in capacity to produce good quality embryos. So their skill set matters. And again, Nova is dedicated in helping couples in such a way that they get the best success rates as per standard success rates of IVF industry. So here what they do, updation of the advancements. So as you can see here, now Nova is actually using what we call it as precise embryo selection. In another way, if I can tell you, suppose that you are hiring for a job. You get 2 candidates of the same qualification. Now, how you can judge that which candidate is better? Then what you look into? The credentials. How many attempts he or she took?
Right.
What was the percentage? How much distinction she is having? And how was she critically acclaimed at all stages in her education career? So in the same way, there is something called as time-lapse imaging, in which if I have 5 embryos and which one is better of these 5, there is a time-lapse imaging system or AI selection system which will tell that what was the time of division, it was congruence or not, and all this they will produce a report card as you see for the interview. And that report card marks will directly tell you that this is the best embryo.
Right.
Again, now we are shifting to what we call it as single embryo transfer, because as naturally happens, a single pregnancy goes till 9 months, and for twins there are complications. So in a better way, only one baby is put in womb and one baby goes till the end, and that is actually increasing what I was talking at the first of this episode, live birth rate.
Right.
So here we are choosing the best embryo and putting the best embryo and getting the best results. And our Nova team is confident that for self cycle, which I told you that our Indian percentage is lagging 7 to 10% of the standard success rate.
Right.
But at Nova, we are precisely maintaining that success rate with the best industry standards. So the couple is happy that they are having child with their own eggs, own sperms and own biological child, as well as the dedicated team and IVF expertise clinician with highest skill set embryologist are there to help with this dream come true. So this is what qualifies for Nova's self cycle first campaign, because we have credibility, quality which you can trust on with the utmost transparency, which actually will help couples in gaining trust and going forward with flying colors having a baby.
That sounds wonderful. Like that, there is a dedicated team and such a highly qualified team and advancements at Nova. And finally, Doctor, if there's one message you'd like to leave for someone who has gone through IVF failure recently or feels completely alone, what would be your message and what would be your thoughts for them?
Yeah, recently I had a patient who had 8 times IVF fail.
8
You
times.
can just imagine like the amount of courage, the amount of positivity she needs to undergo 9th IVF.
That's true.
But it was successful. So here we can see that suppose if you are giving a first standard exam, it is very easy, but for going for UPSC, it's very difficult. So in the same way, if we compare that a student scoring 70% marks and a student who wants to be topper of class needs the same amount of effort till 70% to climb from 90 to 91%. So that much amount of dedication we require, and maybe that 1% may make yes to a no. So what my message will be, a little more persistence, a little more effort may actually turn failure into a glorious success story. And don't lose hope. There are technologies coming, there are expertise coming, the variations are there, and most probably one day you will end up with a healthy baby is what a promise I want to give you.
Thank you so much, Doctor. I think you've been able to break this down for us, giving us such examples with such clarity and compassion. Thank you for being with us here today.
Thanks a lot for inviting me. Thank you.
To all our listeners, if you're here because you've gone through a failed IVF, please know this. You are not alone. IVF failure does not define you and does not mean your story is over. Every couple's path is different, and sometimes the detours lead to the most beautiful destinations. At Fertility Tales, we want to remind you that your tears, your strength, and your hope, they all matter. And while IVF is a medical process, it is also deeply human. You deserve both the science and the support. And here's a thought I want to leave you with. Sometimes it's not about how many times you've tried, but also about where and with whom you try. The right expertise and the right approach can make all the difference. That's all for today's episode. I'm Simrat, and I'll see you in the next one, where we'll continue to share stories, bust myths, and walk this road together. Until then, take care, keep the hope alive.